This is NBC6 South Florida Today.
Well, balding is an inevitable genetic reality for millions of men and some women, not to mention an expensive investment for those in search of a legitimate remedy. Well, today, hair restoration physician Dr. Alan Bauman is here to tell us about new treatments that may fight baldness, also something that may predict future hair loss so you can stop it before it gets too bad. Welcome, doctor.
Thanks for having me, Trina.
It's fantastic to see you again. So many people get so much angst about losing their hair because it's just so much a part of you.
That's true.
You're saying now that there's a way to know whether or not you're going to be in danger of losing your hair?
That's right, that's right. Our diagnostics have gotten so good right now. The newest diagnostic tool that we have is the genetic test for hair loss. So for both men and women, we can take a look at their DNA and say, hey, you're at high risk, or no, you're low risk.
Okay, so we have our lovely model here, one of our beautiful interns. We're going to take a look at her scalp right now. And you tell me what we're seeing when you're looking at it.
When we're doing an assessment for hair loss, we're also going to look at the level of the scalp to measure density and hair caliber. Now, she has beautiful hair,
she does
so
it'll
be a great example of what the beautiful hair looks like. So on the screen here, we can see the hair follicles coming right out of the scalp. She's got good hair quality right in through here. But for a young girl in her 20s who's got a risk of hair loss, the genetic test would be appropriate to take a look if she's got hair loss in the family.
By seeing her follicles close up like that, does it tell you anything right off without doing the, the high scientific test?
Well, yeah, we can measure the density and we can measure the hair caliber. And this we can establish as a baseline treatment. So we can take a look over time. If we decide to just watch and wait, we can watch her hairline, we can watch the density, we can watch the hair caliber and check it.
Now, to do the test, is it painless? I mean, like, for example, if you do a genetic test on a man or a woman.
The genetic test is painless. It's a non-invasive cheek swab, and we send it off to the lab, and in about 5 weeks, they'll tell you whether you're high risk or low risk.
And then what do you do from there if it tells you that you are at high risk?
Well, if you're at high risk, then it's a discussion. It's not automatic treatment. We have to discuss what's possible, what can we do with the non-invasive treatments that we have, such as Propecia for men, minoxidil or rogaine for women, and then we can get more sophisticated from there.
Yeah, because those people have heard about, but there are even more advanced things down, right?
Correct. We have, for example, compounded minoxidil, which is stronger than what you get over the counter. Over the counter comes in 2 flavors, 2%, 5%. The compounded minoxidil comes out in 6%, 7%.
Oh, wow.
With accelerants, meaning it'll penetrate faster to the scalp. Finasteride, which is the ingredient in Propecia, is now able to be compounded. So it can be less expensive for those people who are on the Propecia. We can start them on compounded medications.
And then you also have laser therapy. And I think of laser for removing hair, but this is just the opposite.
Correct. You're thinking of a high-powered laser, cutting and burning. Low-level laser therapy, like these units here, handhelds, are used to stimulate the level of the scalp, stimulate the follicles to grow a healthier, better quality hair, so she can maintain the hair quality that she has.
If you suspect that you might be losing hair, what should you do first?
Well, the first thing to do is don't panic.
Easy for you to say, doctor, you've got great hair.
Well, don't panic, but you got to see a physician. You've got to go to a board-certified hair restoration physician who can apply the tools, apply the diagnostics, apply the microscope, take a look, get a history, get a physical exam, and then talk to you about what's possible, what's not with the treatments. Is it a cause for panic or not? Should you be worried?
And what are the signs?
Well, the signs and symptoms in men would be a receding hairline, thinning in the crown. Okay. For women, you may see a loss of density, you may see massive shedding, you may see increased part lines or part width, you may see a receding hairline.
And ponytails, is that a bad idea?
Well, when you're pulling the hair back day in and day out, that could cause traction alopecia. So tight braids day in and day out can cause hair loss.
All right, Dr. Bauman, always some great information. Great seeing you again. My hair is growing already, I think. If not, I'll throw on some of these products. Well, for more information about hair restoration, you can schedule a visit with Dr. Bauman. He's in Boca by calling 1-877-BAUMAN-9 or 1-877-228-6269.
You can go to the website also for the information, baumanmedical.com.
Fantastic. Thank you, Dr. Bauman.